and welcome to our special program, your special call-in show on coronavirus, where we take all your doubts, any queries that you have regarding the coronavirus, and we'll have doctors answer your queries. We have with us Dr. Sachin Mittal, a consultant endocrinologist, Fortis Hospital, Mohali, and Dr. Varsha Jagtap, a consultant endocrinologist at Dinanath Mangeshkar Hospital in Pune. Thank you so much, doctors, for joining us this morning. And it's been 24 days of the lockdown. I think now that we know the lockdown is till the 3rd of May, I think a lot of people have questions about what happens after that. Dr. Jagtap, first to you, it's not like life will go back to normal because the risks will still remain.
So what happens after the lockdown actually depends upon where you are staying, So like not all nation could be equated equally. I mean, so for certain parts or certain states or certain districts, life can go back to normal, but with certain restrictions. For some other people, maybe the lockdown might be extended beyond that. So we really don't know. I mean, it depends upon how the number of cases increase till then, and then the government will take the decision. So we'll have to wait.
All right. We also have a caller with us, Dr. Satish, calling from Chennai. Go ahead with your question.
Good morning.
Good morning.
I want to ask, I'm an eye surgeon. We want to ask whether after lockdown period, when we start our routine surgeries, like we are doing routine investigations, like HIV, HBs, AG, like that, do we need to screen do we need to test every patient for COVID? Test also is must before posting a patient for surgery, for elective surgeries. Will it become a must or...
All right, Dr. Sachin, like in HIV patients, you always test. So do you think that that's something that's going to happen and should happen?
Well, that's a area which is still, under consideration, what we should do, what we should not do. On one hand, when the patient is being subjected to surgery, there is a possibility that, the body's immunity itself is low. And we know that sometimes the people don't have symptoms, especially early on in the stage of a COVID-19 illness, and they can still be infected. So it can actually, blow the disease out of proportion, or the disease can become magnified. So that's the concern most of us have when we are thinking of planning elective procedures. And as of now, I think it will boil down to what policies government takes. As of now, it is not there. As of now, we have not come to the point that this is something which needs to be done as an elective thing in all the patients. But yes, there is a serious discussion and debate going on in medical community regarding the need for do so and the implications for both the patients as well as healthcare providers for do so. So coming days we will have more clarity on that. But yes, that's a very, very valid point, and almost all the healthcare providers are grappling with the issues of what next after lockdown.
Right.
Because the world is going to be a new normal. It's not going to be exactly the same as it was earlier.
Absolutely, and I can imagine this being a big concern among doctors also, because they're at the front line of treating patients. We have Natarajan calling from Chennai. Go ahead with your question.
Yeah, actually it has to be accepted that India is not hygiene compared to that of foreign countries like UK, USA and other things. Being inhygienic, have we developed a good resistance power compared to that of those places? Or the BCG, everyone had BCG, is it protecting us? Or in the worst part, we have not reached that stage, point number one. And the thing is, second is how the people who are having eye filth, they protect themselves, and what is the advice for them?
All right, so several questions there, and yes, this question that many people are asking: why aren't we seeing more of these cases in India? And is it some sort of, are we more resistant to it? There's all this talk of the BCG vaccine. In fact, we can pull up that graphic regarding the BCG vaccine, but none of this is proven yet, is it, doctors? First to you, Dr. Mittal.
Yeah, so these are all hypotheses. If you look at the BCG data, it basically came from two studies. One was an ecological study, which is basically a hypothesis generating study. It at max tells you about the association, not a cause-effect relationship. I mean, we would love a situation where a BCG vaccine gives us protection, because in our country, with the vast majority of population getting the BCG vaccination, it would be the best scenario to happen, right? But as of now, the science is unequivocal. So we are not 100% sure on that, whether it is happening or not. And if you look at the data with BCG vaccine, primarily it is for tuberculosis, and that too for a specific form of tuberculosis, that is disseminated tuberculosis. And there also, it is not 100% protecting, and the effectiveness wanes over a period of time. So whether does have a role in kickstarting some part of T cell immunity, which basically prevents against some other infections also. But with novel coronavirus, we will have to learn more. We are just learning by the hour, and as of now, it is not conclusive that BCG vaccine is doing protection. Yes, there is an association, which is exciting for a place like us.
All right, and Dr. Jagtap, a lot of people talk about loose conversation about how in India we constantly have virals, we have flus, and we've all gone through a lot of it, and perhaps that's why we have more immunity, and we're not seeing such an effect of coronavirus. Is that very dangerous to think in that manner? And also when we talk about high-risk patients who have diabetes, which is very common in the country, and those patients need to be more careful.
Yes, I mean, I think this is a valid point, and we should not be very, panicky, but we should not be too relaxed also and say that, it is all because of our good immunity that the cases of corona are less. That is not the right way to think. Time will tell us. It may happen that yes, we as Indians may have a different kind of immune system, and that is why we are getting protected against corona, but it is too early to conclude that. So till the time, it is important that all of us take precautions, all of us follow the safe hand washing and other hygienic measures. And for diabetes, it is all the more imperative, because diabetics can develop, if they develop corona, they can develop complications more than the general population. And that is why diabetics need to be more careful in terms of, staying indoors, not mingling with the population, not going outside unless and until it is very important, okay, and doing safe hand washing and other methods.
All right, and also a lot of questions we get regarding exercise during this time, because it's very important for diabetics to exercise as well. So what would your advice be, Dr. Mittal?
Yeah, so I mean, it's very important to prevent corona for diabetic patients, but it's also very important at the same time to take care of the other primary illness, which is diabetes. And we know the cornerstone of management is diet, exercise, and medication if required, right? So exercise is very, very important. There are some home workouts which you can use. There are a lot of exercises which you can do in home itself, which can even be done on a lying down position. So home workout should be done, or maybe if not else, then at least a walk within the home itself. So you might not be able to go to a park, and which is not advisable also currently, but yes, you should keep on doing the physical activity also regularly, which will help you control your sugars, and in case you do develop COVID, then that would be helpful in that time also, because if your sugars are well controlled, then the complications are likely to be lesser.
All right, and don't fall into this sedentary lifestyle, habit under lockdown that all of us are not being allowed to go out at this point. We have a caller from Noida, Nayan. Go ahead with your question.
Yeah, good morning. Yesterday we got a news that a little boy actually has probably...
Right, a restaurant delivery boy tested positive for coronavirus. Yes, go ahead. All right, I think the question was regarding the precautions. Dr. Jagtap, this is of course something, right now we are very dependent on deliveries, be it groceries, even sometimes medicines, even if it's food, food items, and a lot of concerns after this poor restaurant delivery boy tested positive for coronavirus. Possibly he got it from one of the people he was delivering to as well. So what sort of care must one take?
So we need to understand one thing, that nowhere till now it has been proven that coronavirus can be transmitted through food. So like even if you are having contaminated, so if a person who's delivering to you is carrying the virus, okay, and if he delivers the food to you, the precaution that you need to take is that after you have taken the food, keep it aside, wash your hands carefully, okay, as you have been told, and before eating the food again wash your hands. Make sure that the food that you are eating is warm. You have warmed it and you have heated it, and then you are having the food. So it's not that by eating the food we are going to get corona. It is nowhere proven about that. But we need to understand that this is a novel virus. So novel modes of transmission can happen. It's not that it's exactly completely safe, but we need to take precautions. And whenever we get the food or before we're eating the food, make sure that you're washed your hands and then you are eating it.
All right, and the containers as well, fears regarding that. Dr. Mittal, anything you'd like to add?
Yes, yes. So the containers and all the things, we know that this virus can remain on inanimate objects for a varying period of time, from say 3 hours to up to 3 days have been reported for plastic objects, etc. So it's very, very important that once you have touched the container and you have transferred the food to another utensil, and then you just discard the container and just wash your hands properly. So if you have touched the container outside, wash your hands properly, or if you can wash the outside part of it before, if you have to take it, then wash the outside part of it. But very important is that after touching any inanimate object, it is important to wash your hands before you use it, before you apply it on the sensitive areas, or like your nose, your ear, eyes, or your mouth, etc.
All right. We have another caller from Srinagar, Yasin. Go ahead with your question, Yasin.
Hi, good morning, Bobby.
Morning.
Yeah, actually, I didn't have any major question to ask. I just wanted to congratulate you guys for being the best news channel in India right now. This is the only reliable news channel we get to see on TV.
Well, thank you so much.
Keep up the good work and may all you be blessed. And since I'm connected to doctors right now, I would like to ask Dr. Varsha a question regarding the hypothyroid patient. Does the patient need to take any more precaution than the usual person?
So for hypothyroidism, we don't need any particular different precautions than other normal person should. So you should do the same thing, that is stay indoors, stay safe, wash your hands frequently, that's all. Medications routinely as you would otherwise do.
All right, we have a caller from Chandigarh, Praveen Yadav. Go ahead with your question, Praveen. All right, we'll connect to Praveen again. We have Arun calling from Delhi. Go ahead with your question.
Yeah, good morning, Gagi.
Good morning.
A doctor friend of mine told me that as long as corona keeps finding a receptive body, it will not go away till such time the vaccine is there. Is that assumption correct?
All right, Dr. Mittal.
Yes. So, very important question that, in a sense, the first question which you asked, what after lockdown? So the virus is going to stay away. The virus had a natural reservoir in the form of bats, wild bats, and it probably jumped to some other host before coming to a humans. And now there's a human-to-human transmission of a respiratory virus happening and such a connected world it is, and it is creating havoc, right? So it is going to be there for some period of time till we find a solution to it. What can be the solution? The solution, obviously, one will be a vaccine, which is, a lot of work is going on. But we know that to get a vaccine on board, we need a vaccine to be not only efficacious, but also safe. That is effective as well as safe for the people where it has been given. So we expect another year maybe where it probably the vaccine will be coming, or maybe more than that also. Or a drug. Now, the problem with drug is most of the drugs, the antibiotics won't work because it's not a bacteria, it's a virus. And most of the virucidal drugs which have been used in other viral illnesses, be it flu, be it HIV, be it any of the drugs, they have been tried. Lots of these drugs have been tried, but none has been proven to be efficacious right now till as we speak regarding COVID-19. There is some degree of efficacy, something which is there, like some drugs are immunomodulators, some drugs help reduce the shedding, etc. But there is no specific thing. So yes, you are right in thinking that the virus will stay away till the time we get a proper treatment for it or a proper prevention for it.
And all this talk of hydroxychloroquine, which is something Donald Trump loves to talk about, and a lot of demand has come from India, and we're one of the big suppliers, and we've sent out to other countries. But this is all, again, something that is not proven. It's an anti-malarial drug and can be used as a prophylaxis. If you could just explain a little about that, Dr. Mittal.
Yes. So hydroxychloroquine, I would say, is the most political COVID-19 drug all over the world.
Right.
So hydroxychloroquine has been shown in few studies to, decrease the viral shedding or the viral load. But we must see that those were very, very small numbers first. Secondly, hydroxychloroquine, if you look at that, the mechanism of action of this is also not clear. As I said, that it is not virucidal, that is, it doesn't kill the virus. Other possibility could be, does it inhibit the replication or the multiplication of the virus? That also we have not been able to find a target or an enzyme on which it is acting. And also, the only other explanation that is remaining is it a modulator, immunomodulator, or modulates our immunity to help the response in a better fashion? So that's why the ICMR now has given a guideline in very, very high risk situations. I would repeat, in very, very high risk situations like healthcare professionals who are at risk of catching COVID, who are basically, caring for a COVID patient or maybe caring for a COVID patient or, or contacts of a lab-proven COVID patients. Those are where hydroxychloroquine is to be used. Please remember that it is a toxic drug also. I mean, out of panic, people have been asking all sort of questions. Why? What if it proven to be effective tomorrow? Why should I not take it and stock it?
Right.
It may be, but that is not right. It can cause heart problems, rhythm problems of the heart. It can cause eye problems, retinal damage, blindness, etc. So very important to contact your doctor before taking a drug like that over the counter, and don't take it indiscriminately, please.
All right, only under medical advice. We have another caller, Bhaskar Rao, calling from Vizag. Go ahead with your question.
Good morning, Gagi, and good morning, doctors. I have a question. I have two questions. One is that as per WHO guidelines, it is not airborne, but at the same time, we canvas that when somebody sneezes, the droplets which travel in the air might contact the person who is nearby that particular person who has sneezed. Second thing is, it's fine that we have a cardiologist, diabetologist, endocrinologist on the panel every day ever since this COVID-19 menace is hitting the country or worldwide. I would also suggest for those patients who are having anxious moments, why can't you organize or arrange a psychiatrist so that he can also guide the valuable viewers of this country. Thank you.
Right, an important point there, in fact, Mr. Rao, and we are going to get somebody on later during the course of the day. But thank you for your question. And first to you, Dr. Jagtap, the question that he was asking regarding the virus and all the information regarding it.
Gargi, can you please repeat the question again? I mean, what was the question about? First question.
Yes, he was asking about the lifespan of the virus, also about how how long people.
Yes, he was asking about the WHO guidelines.
And the WHO guidelines regarding the aerosols and how long it stays in the air, and so there's been a change in that thinking, and also the advisory we've got about wearing masks.
Correct. So initially the WHO said that it was not airborne, but then the CDC guidelines came in and they did a correction, and then it was said that no, definitely it can be transferred through droplets, through aerosols, and that is why it is important to keep the social distancing and be at least 1 meter away from from two persons, so two persons should be at least 1 meter apart, and that's why WHO initial guideline no longer holds true. So it is definitely airborne.
So you would say that it's airborne. What about these days? Now it's gotten hotter. Everybody's using air conditioning. Dr. Mittal, and is that something and anything you'd like to add regarding this question about the aerosols and how it stays in the air and the reason we have to maintain social distance?
Yes. So so that's the whole reason why this is the big problem, because as somebody coughs and sneezes, it's a droplet infection, and it can remain airborne and somebody can just catch it. That's the whole reason why masks are so important, and that's why we have almost a lawful enforcement that everybody needs to be wearing masks now, because what it does, it basically decreases the dispersion of the droplets. So on one hand, you're thinking that maybe wearing a mask helps me not catch it, but more important than that is if somebody is wearing a mask and if somebody is coughing or sneezing, then the dispersion of droplets is going down. That's where it does play a role into it. So yes,
right, and also because we have all this talk of asymptomatic people who have no symptoms but could be carrying the virus. So therefore, if they wear the mask, it'll help prevent it from spreading further. Yes,
yes. Asymptomatic people, because many people, by law, 80% of the patients are actually going to be very mild disease, and in those patients who are going to be in mild disease, especially early on in the illness, they might not be having any symptoms at all. So and otherwise the symptoms are like pretty mundane, like some degree of body ache, some degree of cough which is dry in nature, some degree of runny nose, etc. And that also compared to a common cold flu can be lesser. So and it's a gradual onset. So many people can think it's because of a change of weather, or as you were saying about air conditioners, etc. Right? Because what happens with air conditioner is that if you having a centralized air conditioning, then it obviously can create a problem, right? But if you having only a room air conditioner, then obviously room air conditioner is not so much of it, and because the cleaning etc. of ducts itself is the problem. That's the major thing. So
we have one last question. Sorry to interrupt you there, Doctor. We have one last question from Bhubneshwar. Manas calling in. Go ahead with your question.
Yeah, good morning, doctors. Manas from Bhubaneswar. I have a question. My daughter, who is 21 years old, she suffers from diabetes, and problem disease. So she takes drugs for reducing, keeping her immune system low. So under these circumstances, what precautions does she require to take?
All right, Dr. Jagtap, his daughter is suffering from an autoimmune disease and she's taking her medication, and he just wants advice on, what precautions and about the medication, I think.
That's a real concern, and it is important to be, be more extra about this. So your daughter, as I can understand, is on medicines which can reduce her immunity, and that's why she is more prone to develop infections. And here comes the most important part of, staying at home, okay, so that she doesn't get exposed to infections from sources elsewhere. So at least, make sure that she stays indoors always. Also make sure that she is, carrying all the other precautions, so like washing her hands, so that she should be doing it more often. The food that you give it to her should be adequately cooked, should be home cooked, healthy food. That advise her to do routine exercises at home also, because it's important that she keeps her immunity at a certain level. Don't discontinue your original medications unless and until you have concerned your doctor. It is important that the original disease doesn't flare up again.
All right, well, that's all the time we have. Thank you so much, doctors, for sparing your time and answering all those questions. And thank you, everyone, for watching and calling in. Time for us to slip into a short break. We'll get you more updates on the other side. Stay with us.